Okay. Characteristics of yin deficient tongues. Everyone possesses a basic constitution that shapes and influences that individual. Assessing a patient's constitution is based on a knowledge of the patient's previous illnesses and their courses of development, as well as on observing the individual's being on rhythm of life. The constitution is also reflected in the face, pulse qualities, and tongue. A person with a young constitution, the tongue is often reddish, long, and big, while with yin constitution, the tongue body tends to be pale and swollen. So, tandaan po natin yan. It is therefore sensible to take note of the tongue, especially its shape and consistency when evaluating an individual's constitution. The kidney houses both yin and yang. Yin manifests in the body through fluids, substance, and structural elements. Pure fluids and body belong to the domain of yin. Yin nourishes and moistens all tissues of the body. Each of the various yin organs controls and preserves a specific aspect of yin. Yin, which nourishes the 5 yin organs and moistens the 6 yang organs, has its roots in the spleen. Blood is stored in the liver and produced by the heart. The lung distributes fluids which originate in the spleen and kidney and nourish the skin and hair. However, the body's yin is rooted in the kidneys. Cool in nature, the yin controls and prevents the pathological ascension of yang. It also limits the rapid buildup of heat. Together with the blood, yin anchors the spirit, which leads to good sleep and balanced mind. Okay? Kidney yin and essence nourishes each other and are mutually dependent, especially in maintaining the body structure and the quality of the fluids. The fluid and blood are yin in nature. Together, they supply the tongue with sufficient substantive energy so that the tongue body achieves its normal volume, elasticity, softness, reddish color, and moisture. An excessive of yin in the form of dampness, for example, inevitably leads to a swollen tongue body. Qi governs the movement of blood and fluids and transports them to the tongue. Thus, the tongue body color, shape, and moisture always reflect the condition of qi and yin in each of the yin organs. Yin deficiency has many characteristic tongue signs. A red tip, crack in the tongue body, and a red, dry, stiff, or in severe cases, even sunken tongue body. So here is a tongue picture example. Red tongue with kidney yin deficiency. A common result of kidney yin deficiency is the development of heat from deficiency, which over a long period of time will dry the fluids and injure the blood. When this occurs, the tongue appears red and dry with little coating. The stronger the heat, the greater the injury to the blood and fluids, which in turn leads to a redder and drier tongue body. Symptoms associated with kidney yin deficiency with heat are tinnitus, night sweats, hot palms, and sores, dry mouth, and flushed face. In case of constrained heat, smoldering fire or fire toxin can develop, manifesting in an extremely red tongue that is covered with a yellow coating. Symptoms associated with this excessive disorder include fever, irritability, a dry mouth and throat, thirst, and mouth ulcers. Heat and fire are capable of injuring the blood as well as the blood vessels, leading to spontaneous bleeding. Heat in the blood is characterized by excessive menstrual bleeding, red, itchy skin lesions, and a general feeling of heat in the body. In this case, the tongue body is completely red, possibly a deeper red or scarlet red. In order to evaluate the origin, degree, and intensity of the heat or fire and the resulting injury to the yin and fluids, the practitioners should observe not only the intensity of red discoloration of the tongue body, but also its shape and coating. Heat generated by deficient yin that smolders for a long time in the body and then becomes uncontrollable will inevitably affects the essence. This energetic deficiency, which can develop over the course of years or be accelerated by a serious illness, may lead to a sudden collapse of the yin, which thereby allows the yang to rise uncontrollably. The mildest expression of this energetic imbalance is the sudden loss of hearing, while its most severe form is cerebral stroke. In some cases, a burning out syndrome, which is often followed by a nervous breakdown, is subject to the same pathology. A good visual image for what happens energetically is a candle burning at both ends. The candle wax is the substance which corresponds to the yin and essence, while the flame corresponds to the yang. At the end, when the wax finally burns away, there is a short, intense flickering of the flame, the excessive, which is the excessive yang. This upward blazing fire in the body vents itself in such disorder as myocardial infarction, stroke, hypertensive crisis, or uncontrollable bleeding. The tongue body is commonly red, dry, contracted, or stiff. The heat has injured the fluids and yin so severely that the muscles, sinews, and tendons, including those of the tongue, become malnourished. This condition can cause the internal movement of wind. A deep red discoloration of the tongue also arises when heat enters the nutritive and blood levels. So here, tongue picture example. Okay. So surprisingly, this pathology can also produce a soft red tongue and indication of malnourishment of these sinews and tendons due to extreme heat. The patient with this tongue type often suffers from hemiplegia following stroke or from atrophy disorders. The soft red tongue is accordingly an affordable prognostic sign, unfavorable prognostic sign. There are many levels of kidney deficiency. Tongue diagnosis can be an important tool in reaching a prognosis for the illness and in formulating the correct treatment strategy. So we have here a case of a female 36 years old. Ang tongue po niya is red, which is a kidney deficiency. Meron siyang red points at the sides, which is a heat in the liver. Meron siyang dry, rough coating, which is an injury to the fluids due to heat. The patient's symptoms is shortened menstrual cycle, extremely profuse menstrual bleeding, very red menstrual blood, hot flashes, and irritability before the onset of menstruation, and depression. Sa Western diagnosis, meron siyang primary infertility and background to disease and happy marriage, frustration, suppressed anger, excessive intake of coffee. Next patient, we have a female, 34 years old. The tongue is red, thin, and cracked. So this indicates there is a blood and kidney deficiency. Next, there is coating without root, which is a stomach and kidney yin deficiency. The patient's symptoms, there is severe exhaustion, inner restlessness, sore throat, numbness of the left thigh, frequent dizzy spells, occasional night sweats. Sa Western diagnosis, there is a multiple sclerosis, chronic tonsillitis, blindness due to optic nerve atrophy of the left eye. Sa background to disease, there is irregular eating habits, frequent bouts of influenza, long-standing emotional problems. Next patient is a male, 38 years old. The tongue is red, slightly thin, indicating a kidney deficiency. There is also a crack coating without root, which is fluid and kidney deficiency. Meron siyang red tip, which is a heat in the heart. In symptoms, there is severe exhaustion, depression, lacking self-worth, night sweats, and sore throat. So Western diagnosis, there is a chronic tonsillitis. Background to disease, long-standing emotional problems since childhood, suppressed anger, and overwork. Next patient is a female, 40 years old. The tongue is deep red, indicating that there is a kidney deficiency and heat in the blood. Also, no coating, which is a fluid deficiency. So symptoms, there is severe, long-lasting menstrual bleeding, dark red, strong smelling menstrual blood, insomnia, inner restlessness. Sa Western diagnosis, none. And sa background to disease, deep frustration with life, excessive consumption of meat, and spicy fried foods. Next patient is a male, 33 years old. The tongue is deep red, especially in the center, indicating that there is a kidney deficiency with stomach fire. The tongue also is a wide shape, meaning there is internal heat and toxin due to alcohol. There's also a deep red tip, which is a heart fire. Whitish slippery coating at the sides, dirty yellow coating at the center. Meaning there is long-standing accumulation of phlegm or phlegm fire. So symptoms, there is severe heartburn, stomach pains, insomnia, nightmares, inner restlessness, panic attacks, excessive sexual drive. Sa Western diagnosis, there is none, and sa background to disease, there is excessive use of alcohol, coffee, and nicotine, excessive masturbation. Sa case history, Mr. S, a 33-year-old social worker, complained about severe heartburn and stomach pains. The pain became worse whenever he consumed alcohol, which he did in large quantities on a regular basis. He also drank large amount of coffee and smoked more than 30 cigarettes daily. Extreme inner restlessness, insomnia, and an excessive sexual drive led to a heavy, unsteady lifestyle. He was exhausted, but at the same time extremely excitable and active. His tongue was deep red. His remarkable pulse was flooding, rapid, and excessive. Analysis during the consultation, the patient revealed that he masturbated at least twice a day because of the frequent loss of sperm. The essence and kidney yin were damaged. The wide, deep red tongue body and the flooding, rapid, and strong pulse were the result of excessive heat. This heat injured the kidney yin, which in turn was unable to nourish the stomach yin. The heartburn and stomach pains were caused by the deficient stomach yin, as well as fire in the stomach, which resulted from a diet of predominantly fried fatty foods, alcohol, and coffee. The tip of the tongue was of a deep red color, in this case, that pointed to the heart fire. The weakened yin, together with heart fire, failed to anchor the spirit, leading to insomnia and inner restlessness. Sa discussion, a red tongue always denotes the presence of heat. Depending on its strength, the heat will eventually injure the yin. If the kidney deficiency is present, the red tongue will be accompanied by a coating that is either without root or peeled. In this situation, it is very important that the yin be tonified. With excessive heat, especially at the onset of the illness, a yellow thick coating will often be visible. When the illness is caused by heat, there will always be a tongue coating. In treating such a patient, it is important to first eliminate the heat before proceeding to tonify the yin. So, tanggalin muna natin ang heat before tonifying the yin. The tongue coating and kidney yin deficiency. A red tongue with peeled coating is a definitive sign of stomach and kidney yin deficiency. This coating has lost its root. Due to the lack of fluids, insufficient material is available for the formation of turbid steam that contributes to the formation of the coating. The function of stomach chi is to ferment the solids and liquids. In the normal course of things during the process of digestion, a little dampness rises to the tongue and forms the coating. However, where there is deficiency, too little moisture rises, and this manifests in the peeled tongue or in an irregularly distributed coating. The same energetic imbalance can create an old-looking coating that it looks dry and gives impression that it could be easily wiped off. Where a new fresh coating should have appeared, the old coating remained next to a raw or dry area. The formation of a new coating does not take place because of exhaustion of an injury to the fluids. The result is a tongue coating without root, which can evolve into a dry tongue or one without coating. A red tongue with no coating at the root, but which is red and dry, indicates extreme exhaustion of kidney yin that has led to kidney fire. Although it does indicate a less severe pathology, the same is true for a pale red tongue with no coating at the root or a discolored reddish root. So here is a tongue picture example. So we go to next patient, which is a female, 28 years old. Ang tongue is slightly red and swollen, indicating that there is accumulation of damp heat. The tongue is also peeled coating, especially in the anterior and posterior thirds. So the patient has stomach deficiency, lack of communication between heart and kidney. There is also a white, slightly greasy thin coating in the center. So this indicates blockage of stomach chi by damp turbidity. Symptoms, there is a panic attacks with tachycardia and pain in the chest, inability to fall asleep, fatigue, fits of rage, feeling of heaviness in the body. So Western diagnosis, there is a cardiac neurosis. Sa background to disease, there is excessive anger and frustration, unsatisfactory emotional relationships, excessive consumption of sweets. Okay. So we go to the cardiac neurosis. This 28-year-old beautician was known for her rash, loud, boisterous, and inconsiderable behavior. For 3 years, she had suffered from heart neurosis and sleeping problems. Her panic attacks occurred mostly at night. Tachycardia and pains in the chest, connected with a strong feeling of fright, had her husband calling for an ambulance on many occasions. Conventional medical findings were negative. Because of her panic attacks, she was unhappy and dissatisfied with herself. In general, she was very aggressive, talked loudly, and appeared restless. The appearance of her panic attacks coincided with the complete disappearance of her sex drive. In her spare time, she sat in front of the television and ate sweets. While her menstrual cycle was regular, her periods were very heavy. The tongue was reddish and slightly swollen. The tongue coating appeared peeled, and her pulse was rapid and thin. Sa analysis, although the tongue body was swollen and of a reddish color, it was the large area of peeled coating that suggests the onset of kidney yin weakness. The coating was specially peeled in the anterior and posterior thirds of the tongue, which is indicative of heart and kidney dysfunction. The history did not clearly show the reason for the deficiency. However, in my opinion, sabi ng author, it was due to her strong fears about life that she would become homeless or that her husband would leave her. The panic attack started in a phase of her life when she lived alone for the first time. She felt very lost and lonely at this time and did not cope well with being on her own. The pill coating reflected quite clearly the location of the energetic disharmony, that is, the failure of the fire and water to communicate harmoniously. The kidney yin was not nourished, nourishing the heart insufficiently. The ensuing fire from deficiency in the heart gave rise to the panic attacks, inner restlessness, and sleeping problems. The profuse menstrual bleeding contributed to blood deficiency. Profuse menstrual bleeding also weakened the liver blood. Her inability to fall asleep and her unbalanced emotion may be due to insufficient anchoring of the ethereal soul, the one by the liver blood. The swollen tongue indicates an accumulation of dampness in the interior. This may have been caused by the overconsumption of sweet, sticky foods. The slightly greasy coating in the center of the tongue indicates an accumulation of turbid dampness in the middle burner, which is related to her inappropriate diet. So sa treatment was directed at restoring the communication between the heart and kidneys, calming the spirit, and nourishing the blood. Simultaneously with the treatments, which lasted 4 months, the patient started to practice Qigong. Acupuncture treatment were given weekly for 8 weeks, followed by treatment at 2 weeks and 4 weeks intervals. As a rule, not more than 4 acupuncture points were used in each treatment. 2 sets of points were used quite frequently. The first set consisted of Heart 7, needling technique is draining, CB15 neutral, and kidney 4 tonification. The second set consisted of PC6 neutral, liver 8 tonification, kidney 3 tonification. After 4 months of treatment, the patient felt well. She became noticeably quieter, more relaxed, more pleasantly mannered. She has not had any panic attacks for 2 months. In addition, the tongue lost its peel coating, although the tongue body is still slightly swollen and of reddish color. To stabilize the communication between the heart and kidney, the prepared medicine Emperor of Heaven's special pill to tonify the heart, Jiang Wang Bu Shindan, was prescribed for 12 more weeks. So here is the tongue picture before and after treatment. Thank you for your attention.